child and adolescent mental health is a very broad scope that deals with a lot of professionals. So it's what we refer to as a highly multidisciplinary field, and basically addresses problems regarding children and adolescents that have to do with their mental health.
I believe that culture has played a big role in terms of how it's perceived by the general public. We assume that children necessarily don't have issues or problems. And you find that in our local parlance, why are you thinking, do you have any problem? As for children, do you have any issues? We say that a lot without necessarily thinking that everybody, once you're a human being, you have a mental health and then you also have a physical health.
So worldwide, we say about 1 in 4 children have some form of mental health issue. And I think we can say the same in Ghana too. So we don't have a lot of data specific to Ghana, but in general, from what I experience in the clinic, I think we can use the same worldwide data. So we see quite a lot. So today was my clinic day here, and I've seen a whole lot of children. So on an average clinic day, we can see between 15 to 20 children, yes, with mental health problems. And then during the week, which is not the clinic day too, we have some coming in. So we have quite a number of children with mental health issues.
One community study that was done in Kumasi showed a general prevalence of about 33% in the community, and we found different mental health issues or disorders among children of school-going age.
Usually for children, we have what we call developmental disorders most of the time, although they also have some of the diagnoses that adults have, like schizophrenia, like depression and whatever. But lots of the problems children have, we have developmental problems. You see them at school where they can't pay attention.
Usually, the only times we get referrals, or we probably get them coming in, is when, for instance, they're in school, they're having certain challenges in the classroom, and you are forced to come see us. So that's the only time they come, because either the school is refusing to take the child, or maybe they've observed something and there's no help, and for that matter, the child needs to come in. There have been a few times to where some parents who have a lot of knowledge about illness would also just walk in and say they want to see.
Usually, the moderate to the severe forms of intellectual disabilities seek help in the hospitals, whilst those that are mild may just receive some beatings a lot in the schools or at home for being dumb or for not being brilliant.
Because if you are retarded and you go amongst your siblings, you are not able to perform, your younger siblings do well in class, everybody calls you, you are dumb, you are daft. Emotionally, it will affect you, isn't it? But children don't demonstrate mental health problems like adults. You may think they are defiant, they are troublesome or something, because they can't really express themselves. Like a child is in school, becomes depressed, becomes very, very rude or something like that. So teachers may think this is a rude child, this is a child who doesn't pay attention, fighting everybody. So they may be depressed. It has to be assessed by a psychiatrist or a psychologist to confirm that the child is depressed.
So depression and anxiety problems commonly occur in adults, but sometimes we have children also coming with such conditions. But most of the time they come with other things. Sometimes they have epilepsy or seizures or fits, and then sometimes they have autism.
Autism is one other some of these mental disabilities that children have. You find a child that is unable to really interact socially well. So whilst everybody is mourning and crying, they may just be laughing because they don't see or understand what really is going on.
Some have attention deficit hyperactivity disorder or ADHD.
When we talk about mental health issues, causes are not unilateral. They are multifactorial. That means that we are looking at different things bringing about a problem.
We don't say specific causes because most of the time we can't really tell where the problem is coming. So usually we say risk factors.
Like a key and a lock. Sometimes a person is predisposed to a certain condition, but they need the right environment. So once they get that environment becomes like a key, it opens that door, and then you have, all of those issues springing up. So causes for some conditions are even unknown, but there are speculations or theories regarding what might have triggered or what might have resulted in the person having it.
There are things that happen often during pregnancy, delivery, things that don't go so well. That can be a risk factor for developing some of these conditions. So sometimes difficult labor and delivery. So the labor goes on for a very long time. The child is not delivered on time. The brain is starved of oxygen. Then we have some of these conditioning happen. Sometimes it may be during pregnancy. So some infections that occur during pregnancy. Sometimes taking alcohol and not eating very well during pregnancy can cause it. Sometimes the baby is born all right, but they develop yellowing of the eyes. We call it jaundice, and the skin. So that can also cause some of these conditions. Or the child becomes very, very severely ill when they are very young. So when they are babies before the age of 1 month or early childhood, they have very severe illness, they become malnourished. Some of these things can also cause. And then as they grow older, depression is mostly when you have difficulties in the environment. So sometimes their home environment is not so good. So they experience a lot of abuse in the home environment, family disharmony, those kind of things can also be risk factors for depression in children and adolescents.
There's also the issue of verbal or physical abuse in homes. If children are verbally or physically abused often, they can fall into depression, especially if they are molested without parents knowing. Or probably they've even mentioned it. There was one case like that. The child mentions it and then the father feels that it's because you're a bad boy. In this case, it was even a boy who was being molested by a very old woman. When he comes home and then reports it, his daddy tells him that it's because you're a bad boy, that's why you are being molested. He never took it serious. The child grew up. Right from then, he started falling into depression. He grew up and then he's totally depressed. It's terrible if you should look at him when he has his episodes. And recently, he met that woman who was molesting him and then the episode just triggered. It was terrible. It was very sad.
Man is a spirit who has a soul and lives in the body. If you read the Bible, Jesus on several occasions had occasions where he interacted with people with mental cases, and most of them he healed them. If there's any institution that will understand them better, it is us, because we know 99% is spiritual. 99%. If you ask me, I can't prove it with any science, with scientific data, but from where I sit, we have demonic influences, and a lot of interaction I had with some professionals. So I would say that yes, some are very spiritual, and spiritual where they are caused by the manipulations of demons. And when man fell, man lost God's image, God's protection. Man became vulnerable. So and some can be caused by curses. Curses are demonic powers that manipulate people's life and cause certain events to happen consistently in a certain manner. Some too are curses. We have instances where somebody will say, well, my great-grandfather, my mother maltreated somebody or did this to somebody, and somebody pronounced a curse, that there will be mental cases in your home all the time. And indeed, once you begin to pray, there are manifestations that confirms that. And then once the prayer takes place, the person becomes free.
With mental disorder, one thing that really helps is identifying the condition early and then seeking early treatment. That is when it is properly managed, and sometimes it can go away depending on the type of mental disorder, but most of the time it is chronic, so most of them are managed. There was once this kid with seizures. She was 13 years old when she was brought in, and a 13-year-old should be able to walk, but this particular person was being carried at the back. Then she was drooling all over, couldn't speak, she can't use her arms and then legs. And when we probed further, the hospital was their last point of call. They had roamed all about just to seek for treatment, and it was quite unfortunate. At this point, she was like a vegetable. There was nothing much that we could do.
Listen, the churches, those who do, there's lack of knowledge, and they think they are doing their best. You know, sometimes those patients can get very wild, and because these pastors don't have training, to them, they think that that's the best. That is why I also blame the mental health institutions. Why are they not organizing platforms to collaborate with the church, to give pastors some kind of training? Ministry of Health should consider that. So I wouldn't entirely blame those pastors. They don't mean evil. You talk to them, they don't mean evil. To them, and even for them to provide that a place, because when these things happen, they are wild in the home and they are harming people, and those churches rather accommodate them. They should be credited, giving some credit. Yes, what they are doing compounds, some of them compound the problem, but I think that it is not done willfully. That is why I'm calling for collaboration. I think that the mental health institutions who know better should find a way of reaching out to the church so that we can correct these anomalies. There are cases where the doctors themselves will tell you, this one, we've done all we can, so go and see a pastor. We don't need to decouple the two, we need to collaborate. I expect to see the mental health institution reaching out to the church, and we also reaching out to them so that when there are cases, after we've done our part, we refer them to the professionals to deal with it.
And that's why we have a lot of people committing suicide, or a lot of children committing suicide, or attempting to. We don't understand. And what do we say? We say that it was a spirit that took over the child, and then the child, and this one has never happened in the family before. Maybe the child has depression. But do we even listen to our children when they're talking? Do we pay attention to what they're telling us? When they're feeling sad, what do we tell them? You are not paying school fees, you are not paying bills, why are you sad? But they have their own issues at that age as well. So these are genuine concerns. They have nobody to talk to. They don't even understand what's going on with them. So what do? They'll probably feel that, okay, so maybe if I'm not here, it's better. Sometimes even some children, based on what parents are saying to them, you are useless, you are this, you are that, they start believing, because what they're doing is they're like sponges, so they absorb. So they start believing what it is you are telling them. And for that matter, something like anxiety and depression, which are common mental illnesses in our system, definitely, it's something that, you know, as you're growing older or aging, it becomes more complicated, and so it would start showing, because maybe that person had the luck based on genes, but then it was only up to that environment to create something for that to come out.
When I was a student, and there were times that people come to church with such situations requesting for prayer. The immediate point of call for Ghanaians or Africans, we are very religious, is the church. So I've had a brush with such conditions.
So most of the time, yes, they don't report early. And in general, mental health in Ghana, most people don't come to the hospital first. So they try going for prayers, they go to for herbalists, and try all other means before they come to us. So in general, we hardly have them reporting as early as we wish them to come. So for children, not as much as adults, but most of the time they come late. Sometimes not because they've gone looking for help elsewhere, but because they think the child will outgrow it. So if you have a child, for example, who is not talking at 3 years, ideally that is the time to report. But the parents will think, oh, it will get better, it will improve. Let's wait a while. Like a child I saw today, the mother said she was told that for boys who are firstborns, it takes longer for them to talk. So as at the age of 5, the child was not talking. And they thought, oh, it will come, until now the child is past 5 and he's still not talking well. That is when they are coming. So sometimes they don't go anywhere. It's just that because of our beliefs and some of these myths, people think that, oh, it will happen. They say, well, child firstborn there, there's nobody, he's not talking to anybody, so that's why he's not talking. But normally by 3 years, if a child is not talking, you have to be concerned.
The first thing they'll think of is probably someone in their family does not mean them well. So they would initially go to a pastor to seek for help or assistance. Then there are just concoctions, they give them all prayers, fasting and all that. Some would also go to the herbalist. And then they are giving concoctions, they are giving something to rub against the patient's skin and all, maybe morning and evening. Very bad odor. When they come, they tell us. So it looks like that's their first point of call. They go there for a number of years, and then when they realize the condition is not getting any better, it's deteriorating, that is when they later come to the health facilities to seek for extra assistance.
Well, mainly is because they are religious. The other reason being some don't have money to send them to the hospital, and they know that church doesn't charge for such services. So aside those who come because they are religious, majority is because they don't have the means to send them to the hospital for attention.
Let's say I'm even doing supportive therapy. You need about 12 sessions. So if 12 sessions, I say pay 50 to 80 cedis per session. You see, so for any time you meet a psychologist, you pay 80 Ghana. Depending on, because you can even pay up to $200. That is it, because you don't, when you have a child as a client, you don't have one person, it's not a child. It is the parent and the child. So, and the father and the mother. So the whole family may be your client. So it's supposed to be more expensive.
So if it comes to the family, definitely, if I need to cough out 150, depending on who I am or where I'm working and, you know, my means, social status, 150 might be okay for me, but might not be for someone else who is struggling to make ends meet and needs to take care of family, needs to pay school fees, needs to, you know, they have like 3 or 4 children who have other challenges or difficulties. And then he also needs to take care of other family members, not just immediate family. You prioritize, and they prioritize. So if I realize that, I mean, if I have to come every session, example, if I'm seeing a client, a child with who's struggling with anxiety or depression, and I need to see the child every week, weekly sessions scheduled, every week I'm coughing at 150. That's quite a lot to that person. And for that matter, it'd be very difficult then to say, okay, I can make it. Maybe they'll come 1 or 2 times, but then afterwards you won't hear from them again.
We've been advocating for the mental health issues to be put on the health insurance. so that at least they can get their medications and consultation for free. So that we have been trying to do. The only thing is that by law, mental health is supposed to be free. So it's difficult to say now that we should put it on health insurance, but we are still trying our best to advocate for it to be done.
My name is Miss Esther Mante, Head of Community Psychiatric Unit, Tafo Government Hospital. I've been working as a psychiatric nurse in Tafo Government Hospital, to be precise, for the past 13 years now. And since community psychiatric nurses was established here in 1976, we have a whole lot of challenges that we would like the community or the public to be aware, so that if they can come to our aid. Looking at the situation, and we don't have a permanent places that we work with, it's a big challenge, because even within our daily activities or daily routine, we attend to 6,200 clients or patients a day. In the year 2019, we attended to a total patient of 13,577, in which 2,319 were new cases, including child and adolescent mental illness.
And with Tafo Government Hospital like this, it's been there for ages, like over 20 years now. But then we have no place to call our own. We do not have a unit or a building of our own. We work from the hospital library, and then we are moved anytime the administration feels like they want to have a meeting. Even if we are attending to clients, would probably give us, you have 2 hours, you'd have to attend to all these clients, and then you want to use the place. So there's no privacy. And when you're attending to clients like this and then you don't have time, or it looks like you are rushing through, no privacy, they don't really tell you all that is wrong with them. And then if you don't get the history well, it affects the type of treatment plan you have for them, which would also affect their recovery. So no privacy, as I said. So sometimes you are talking to this particular patient, and then the other patient sitting by them is listening in on the conversation. So you are like, Mommy, me patronya no kasati, doctor no kasa, me way kasa. So the patients don't feel comfortable revealing all that is wrong with them. Because when they are talking, sometimes they are looking around whether someone is listening, because some issues are confidential. It's supposed to be shared between you and your health provider. That is unfortunate. And then there will be other nurses who are also having their rotation around. At a point, we can have like 30 to 40 rotational nurses in the library, in that same room with us. In addition to the staff nurses over there, we who are working there permanently, we are like 15. We run shifts. So maybe, let's say, 10 will be for morning, in addition to the 30 to 50 rotational nurses. So the place is overcrowded. And you would walk in and sometimes the place is really stuffy, because these patients we are attending to have psychological problems. So sometimes maintaining their personal hygiene is an issue. Someone has not taken his or her bath for like days, weeks. They come in, they are spitting all over the place. With all these people, it's God who is protecting us.
Aside that, too, the building we find ourselves in is in a very, dilapidated state. We have most of the roofs leaking. You realize that the environment is not very serene to even take on children. So we are pleading for all the help we can get to address all of these challenges mentioned.
Imagine a doctor ratio of 1:100,000 people. Actually, the doctor ratio we have in Ghana generally is 1:1 million people. But as for in the field of psychiatry and child and adolescent mental health, I cannot state the proportion we are going to get. I mean, it's woefully inadequate. So yes, so it makes you work under circumstances where you're under a lot of pressure and you're not able to give off the best you should give. I know a lot of the hospitals may not even have some of the other professionals I mentioned, like the occupational therapist, the speech therapist. I mean, the whole, of my place of working, there's only one qualified speech therapist, and sometimes I can imagine the cases being referred to him and how he's able to see all of them.
Well, I just want to say that it's an area of need and we need a lot of support. So there's a lot that we can do in this area. There's a lot of other areas that we can reach out to if we have enough resources here. So for example, I do a clinic at Osu Children's Home as an offshoot of this clinic. So we go there to go and see the children there. And they have a lot of special needs children or children with mental health issues there. But they are not able to come here because they are also understaffed. So we go there to see them. And then there are some other areas that we can. So that's only one orphanage. There are a lot more orphanages that we can see. They have the prison services, which have a prison service for childhood offenders or adolescent offenders. That's another area that we want to be able to reach out to if we had the resources. But for now, we don't really have a lot of resources. So we are doing it gradually. So if we have a lot of resources, there's a lot more we can do.
We need space that is private and that is safe for the client to feel comfortable to open up. I'm saying that because in some places where I've been, you as a psychologist, you need to prove that you know your job before they can even believe or trust and give you space. You have to fight for space. It's like you have something to prove even to the medical professionals. So there's this thing with medical professionals and then also the mental professionals. But we are all supposed to be working together, but there is that challenge, interestingly, and it's something I can say on authority that is well documented. And sometimes they don't even understand what it is we do, our role in everything. So that is why you'd probably get a medical professional waiting until the last minute to say, oh, we're going to theater and we're going to amputate somebody's leg. Can you come and say something? Why did you wait all this while, whilst you knew this was going to happen at the end of the day? Why did you wait until the last minute? So just when they're about entering the theater, that's when they're calling you to say, please, can you help? What am I going to do? It becomes very difficult. And that tells you that there's some kind of, I don't know what it is, but there's a struggle or there's some lack of understanding of what our role is. All right. So we need good space and we need, as much as possible, a place that we can actually keep or store good information.
So now I would say that child and adolescent mental health should be an issue that is being discussed in our country. In the height of government, it should be one of the things that should come up, and it should be discussed together with the health sector, the education sector, and all the necessary stakeholders, because we keep saying children are the, you know, the leaders of the future leaders, but we look at the crop of children that we have. Some of the issues that we keep complaining about are mental health issues that need to be addressed. We are training or teaching children in schools, but before a child can do well and perform at their optimal function, they need to have a good mental health. We need to be talking about this everywhere, and it should be something that must be of utmost interest to government in bringing policies, in drawing the educational plan. We need to institute and inculcate, you know, things about mental health in the curriculum that will help to address, for children to understand these problems and also help to address it. We shouldn't just look at children going to school, providing free education and free this and free that. We should also help to give our children a good mental health. Recently, in the issues that came up during the ended WASI examinations, looking at the behaviors of some of the children, the advent of the COVID era and the changes and what they were expecting, the exam or practices, I just could see that, no, these children, their mental health needs to be worked on, so that whatever we are also providing for them as a government, it will actually be useful for them. It will not be laid down to waste.
Yeah, so the schools too, we also wish we could do a lot more of preventive, so we can teach the children about taking care of their mental health, not getting into substance use or drug abuse, as they say. That will also help them to have a better mental health, teach them about recognizing some of the conditions early and seeking help. So there's a lot we can do in the schools too. So the need is a lot. But as you can see, the personnel, we are not many. So we spend a lot of the time in the clinic. We do some health education. And then as far as we can, that is what we do. We do training of other people to be able to assist in managing the conditions.
So many conditions in this world, or ill diseases, don't have a cure. HIV doesn't have a cure. H1N1, even COVID, we don't know. So if I say that mental health problems or mental disorders too, and majority of them don't have cure, it doesn't mean the person is useless. The person can be on medication or receive therapy. Whether the person is a child or not, they can do something.
So sometimes when the patients come, they even ask us, hey, can I use you? Sure. Hey, anyway, people are so we'd have to explain to them that there are no more coming, but when it comes, we'd definitely go for it and then bring it to them. So, especially with childhood mental disorders, their drugs they are not subsidized. The very quality ones that are there, like the Concerta and then the Ritalin, the average Ghanaian mother or Ghanaian parent might not be able to afford it. So sometimes managing these cases becomes a problem. So you find we've realized that these therapies work in combination with medications. Sometimes it's only therapy. But if the patient is not able to afford the drugs, then it means we are doing only the therapy, but then what's the medication? The medication aspect is not being fulfilled. So it means the client's recovery is going to be slowed down.
Sometimes medications are not available. Sometimes the support services that we need. So I wish that everything that I need for a child with mental health challenges will be here at one place. So I wish there will be a pediatrician here. I wish there will be a speech therapist here, physiotherapist. Everybody will be together. Then I don't have to be sending the patient to be going to multiple places and be paying much more money. So those are some of the things. And then the cost. So sometimes I have the medication with me here, but the person cannot afford it. So some people simply cannot afford. And then some of the services too are only in Accra. So like the experience I shared with somebody coming all the way from Odumase Krobo, comes here. I know what is wrong with the child. I know what can be done to help, but I can't do anything about it because they are so far away. Even coming here once a month is difficult for them. So if I say they have to come for speech therapy twice a week, to be very expensive and it will be difficult for them. So those are some of the issues.
We are all managing though, but then it isn't the best. It has to be improved so that they can be cared for, because some of these conduct disorders that are not managed well is what later results in the theft cases we see. These people end up being thieves and then intelligent psychopaths duping people and all. And they think they are smart, but then they are suffering from mental disorders. So in the long run, it affects the whole nation.
I think just to wrap up, what I would say is that everybody has a mental health, just like a physical health, and you can't do without the other. You can't do just physical health and then let go of. Because when we're talking about you being in a good state of health, you have to look at all of these, including the social and the emotional and everything else, attached to it. So as much as possible, what I would say is that let's take care of our mental health just as we do our physical health.
I want to advise everybody that mental health issues, we are all prone to it. You may not have it today, tomorrow you can have it. I mean, if you look at how it is acquired, stress can be a factor, demonic attack, name it. I want to advise that we should desist from stigmatizing mental health patients and even mental health medical professionals. It is a noble job. If there's any part of the field of medicine we should celebrate, these are the people, because they sacrifice a lot to ensure that our brothers and sisters who have this condition are cured or we're able to manage them. Can you imagine a nation without a mental health department? When your relatives have issues like that, where would you send them? You have to stay at home with them. And can you imagine when some of them become very wild and begin to create problems? So let us renew our minds concerning this department. Let's give it our support. And I tell you, we would have been eradicating, if not 100%, but 99% the conditions in Ghana.
Dr. Ruth Charlotte Saki.
My name is Dr. Selassie Adom.
I am Sarah Watsma Yemwa.
My name is Diana Ban Odu.
My name is Reverend Stephen Wengam.